A bucket list experience in a place known for its beauty, now seemingly behind a growing medical mystery with a bevy of frightening symptoms.
Oh, I'm horrible.
Matthew Wappett of Utah says he's been sick ever since his rafting trip down the Grand Canyon's Colorado River back in May, sharing it started after he skinned his knee mid-trip.
It was weird, but my whole knee just swelled up, was red. It was, it was awful.
Wappett also began to experience symptoms he says felt flu-like.
And I mean, like I try to explain it to people. I mean, it feels like I did a hard workout every day, even though I've done nothing except for sit on my butt.
When he went to a hospital, Wappett's doctor sent him home with antibiotics for his knee. But his other symptoms lingered, then grew worse. In a search for answers, he posted on a Grand Canyon Rafters Facebook page, noticing others describe similar symptoms. One man sharing several people on his rafting trip had the same issues, among them fever, fatigue, and muscle soreness. Adding, doctors are all stumped so far. In a statement to NBC News, the National Park Service says they're now investigating those reports off social media, and they're not able to comment on the extent of the illnesses, potential diagnoses, or other details while the investigation is underway.
That clustering together of many different people complaining of the same symptoms absolutely is something that we thought deserves a bit more attention.
Dr. Nahid Bedelia is an infectious diseases physician and director of Beacon, a disease tracking platform at Boston University.
We don't yet know if there's a unifying cause for all these reported illnesses, and that's what the public health investigation would probably tell us.
Rafting trips are popular during the park's busy summer season, welcoming thousands each year, and tonight they remain open. If you have a rafting trip planned, should you postpone or simply be aware?
I think this is a simply be aware. I think some good public health practices are, if you're traveling through these areas, use DEET containing, of course, mosquito repellents, wear long sleeves where you can. Make sure you see a doctor if you feel any symptoms.
Morgan Chesky joins us now. So, Morgan, doctors so far are stumped, but are there any leading theories as to what this could be?
Yeah, they're certainly looking into that, Tom. Doctors are exploring multiple possibilities right now, with the leading theories pointing to what's known as valley fever. This is a fungal infection that develops in one's lungs that's typically concentrated in those southwest states, or something known as leptospirosis. This is a freshwater bacterial infection that does appear to match some of the symptoms that these rafters are describing. Health officials also testing illnesses that are spread by ticks and mosquitoes to at least try and rule out any other of those environmental causes. But for now, it certainly seems that medical experts are stumped. Tom?
All right, Morgan Chesky for us on this strange one. Morgan, we thank you for that. We thank you for watching. And remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.